if you would, and explain the nonprofit you're with and what your mission is and how we can work on this, especially now.
Sure, thank you. I want to apologize also because part of this was a mutual technical problem. I am currently on Zoom on my phone while my computer decides that it doesn't want to do that.
Oh,
So
shoot. Okay.
I do have slides and I can share them with the group. And I can maybe share them with you so that you can share them out with everyone. But while my computer is struggling, I can just talk for now.
Okay,
so I can share these in case somebody else would like to send them out to everyone. I'm going to send them to you over email right now. And they're Google Slides.
Okay. Awesome.
Okay. So you have my slides now. And if you share them from your share screen, I can talk through them as well.
Okay. I don't see them yet. Did you send them to my healthcare at LWV Colorado?
The email that you had just sent me.
Yeah. Okay, good.
Do you need me to stay, Thalia?
You know, just to get me through this technical mess. Yeah, that'd be awesome. Okay. Let's see. I don't see them. Oh, here we go. Here's a new. Okay. So do I just simply share screen?
Correct at the bottom if you click share.
I think I can do this now. Yeah, hold on. This one. Okay, so everybody see that?
There they are.
There we go. Oh, yay. Okay, thanks everyone. Thank you, Jane. Thank you, Manat. Here we go.
Okay, why don't we start with the next slide?
Okay. How do I, oh, wait a minute. How do I do that? There we go.
Okay, so first I would like to introduce myself and apologize for our mutual technical glitch here. But my name is Manat Singh and I use she, her pronouns. I am the executive director of the Colorado Consumer Health Initiative. I started at CCHI in May of 2022. Prior to that, I've been working in healthcare policy in Colorado primarily, but also nationally for about 15 years now. I started in grad school here in Colorado. I moved to Colorado for graduate school to get my master's in public administration, and I started working with local nonprofits and foundations, and wanted to get a sense of why Colorado was so unique in a lot of its political and policy ways. And I saw Colorado as a place where there was a lot of opportunity for me as a former young person to join in the fight to do some civic engagement work, health policy work, health politics work. And so that's what brought me here. And all of my experience kind of led to me joining CCHI a couple of years ago. So who is CCHI? CCHI is a statewide, nonpartisan, nonprofit, membership-based health advocacy organization whose mission is to ensure all Coloradans have equitable access to high quality and affordable healthcare. CCHI started in 2020, a group of deeply caring health advocates, policy experts, local government folks, foundations, found that there was a need to improve the access and quality of healthcare and affordability of healthcare for Coloradans. And so that is where CCHI started from. We're actually, this year is CCHI's 25th anniversary, and we're throwing a big celebration fundraiser at the end of this year, but CCHI has been in existence for quite some time now. Next slide. Okay, so what do we do? What did all that gobbledygook that I just kind of shared mean? We do, oh my gosh, my computer just worked. My computer just started. I can do my computer now.
Okay.
Let me switch for 1 second.
Okay. Nice. Tell me when to stop sharing.
I am here now.
Okay. I can see you, your beautiful face. Should I stop sharing?
Sure, if that's it can work either way. If you're continuing to share, or if I do, it's the same to me.
Okay, all right, let's just keep going then.
Okay. So CCHI, we do this work on affordability, equity, and access by looking at state level healthcare policy and advocacy. So we work with our state legislators, agencies, local communities, community-based organizations, and everyone to work on policy together that works for Coloradans. On a federal level, what we do is we look at what is happening on a national level that informs what's happening here in Colorado. And we also look at what Colorado is doing that's informing the national conversation. So that's an important piece of it. For the federal advocacy work, a lot of that is primarily around funding, which is something that I'll be talking about a little bit more in a bit. But there's a lot of cohorts of other states that learn from Colorado and that we also learn from. So we have similar states working on similar issues around reproductive health care, around surprise billing, around marketplace affordability. So we have cohorts amongst other states, and we use our kind of collective power to push the national conversation. The other work that we do is administrative advocacy and implementation. So for any of you who've worked in politics, policy, or anything like that, you know that passing a law is not the whole picture. It's then what happens after a law is passed. So all of the rulemaking, regulatory work, implementation work that requires appropriations, requires staffing, requires somebody monitoring and enforcing those laws, we do a lot of that work too. Our policy team actually did a quick scan of how many implementation projects we're tracking this year, and we're at about 60 different implementation projects for different laws and programs that have passed in the past couple of years. And so our team also looks at that. The other thing that we do is research. So a couple of examples of research projects we do are things like, how are hospitals financed? What are all the different ways that hospitals receive funding, and what do they spend that money on? So we do policy research work. We contract with universities, with consultants, with contractors, with experts to do that work as well. And that helps support the work that we're doing. And then we have a consumer assistance program. Our consumer assistance program started in 2018, and this is a program that was addressing a need that everyone in Colorado can relate to. Everyone has either been this person, or has a friend who's been this person, or a family member, or a loved one, or a neighbor. If you go and receive care and you are expecting a bill to be $200, a couple of months later, you get a bill that's $5,000. What is happening there? Was there an incorrectly billed medication? Did your coverage change? Was there some fraud happening? Were they just trying to get more money from you? You might go into collections, your job situation might have changed. And so our consumer assistance program launched in 2018. It is a free program, and we have staff there who you can call and say, I don't know what this bill is. I don't understand why I have to pay this. I believe this is wrong. And we do all the navigation for patients who send us their information and help them appeal that process, get better coverage, negotiate with the hospital or the insurance companies, make sure something really is medical necessity, make sure your drugs should have been covered. And in the 5 years that it's been operational, this consumer assistance program has saved Coloradans almost $11 million in medical and prescription drug savings.
That's amazing. Do you know, like offhand, is it mostly incorrect billing or negotiating things down, or do you know?
So a lot, it just really depends, but a lot of what we assume is that there are loopholes within the healthcare system, or I shouldn't even call them loopholes. There are deliberate practices within the healthcare system to get as much money as possible. So whether that's a mistake or a deliberate denial of medical necessity, or some struggle with in and out of network kind of issues, our assumption is always, we can fix this. And oftentimes we can. And sometimes it is even just a matter of negotiating down, like, look, this person's financial situation changed. We understand that it is in your right to charge $5,000, but they simply cannot pay it. Can you do something else? And so it just depends. We have some clients that come to us with $20 bills that are simply wrong. And we have a client even last year who had a $500,000 bill that we managed to entirely wipe out.
Oh my gosh. Fantastic.
Yeah. So this program is crucial. And I will say, for the first couple of years, it was a staff of 1 plus or minus a volunteer. and we've managed to staff it up to about 5 full-time folks now, and the need just
Ooh,
keeps growing.
that's amazing. Great.
Yeah, thank you. The last thing that we do is community engagement, education, and outreach. And what that looks like is we show up at libraries and do know your rights presentations. So what is your right as a patient in the healthcare system? What this means is we show up at rallies and events and table and talk about the work that we're doing. We work with our community-based organizations and language justice organizations to make sure that communities that need other kind of cultural competencies or fluencies are also understanding the same information that we all have. And then we work with these community members to do education and outreach to also then help them, empower them to tell their own stories, so that we're not the ones always speaking on behalf of other folks, but where other folks would like to testify in committee, join public commissions, present on their living experience. We're making sure that we're engaging the folks that we're directly impacting to empower them to advocate for themselves as well.
Fantastic.
I would like to also let everyone know that we are a staff of 13. And so with all of this work, you know, there's a lot of departments of one, and we have a lot of really amazing people that work here. My colleagues are embarrassed every time I say this, not embarrassed. I think they find it endearing, but it's the best job I've ever had with my favorite people I've ever worked with.
Oh, that's nice.
And the work itself is so rewarding, but the people we work with are unmatched to me.
Fantastic.
Okay, next slide. Okay. So what we're currently working on for some broad buckets before I set up kind of what it is that we're asking folks to kind of discuss or ask questions about or engage in is what our current state and federal priorities are. So broadly, our current priorities are protecting the safety net programs that keep people covered, advancing finance reform that supports that affordability and access piece, and then improving the quality of coverage and things like protections from surprise billing. So on a state level, protecting safety net means protecting Medicaid, Cover All Coloradans, and OmniSalud, which are coverage programs that help folks that are lower income, undocumented, children, pregnant people, and other folks that are struggling with affordability or who are otherwise excluded from federal subsidies or assistance. On a federal level, again, that's Medicaid and the affordable marketplace coverage that we have through the Affordable Care Act. For advancing federal financing reform, we look at hospital financing and safety net supports. So what that means is, you know, a lot of times we talk about insurance as kind of the big villain in our healthcare system, but there's a lot of big players with a lot of money that are driving the cost of care up. And one of those things includes hospitals. And hospitals will charge and contract with insurance companies upwards of 500% of Medicare kind of estimated costs, right? They'll sue patients sometimes. There's a lot of great hospitals that provide great care too and work really hard on affordability programs, but it's not all hospitals. And Colorado has a particularly consolidated state. So we have a consolidated market in our state. So there's mega systems that are gobbling up independent practices, rural practices. And as they do that, they charge more and more. And so we're looking deeply into the hospital financing and what those safety net supports need in order to keep stable and provide care to their communities. On a federal level, we're looking at things that are called site neutral payments. So just because hospital A acquires hospital B, and where does somebody receive care, you know, there's this making sure that it doesn't matter where you receive care, it's what care you receive, and looking at what site neutral payments can look like. So this is things like facility fees. If you've ever received a bill where you go to your regular doctor to do your regular appointment, but it gets acquired by a hospital and all of a sudden they're charging more, how do we keep the site neutral with those payments? And then improving the quality of coverage and protections from things like surprise bills. In the state level, one of our big focuses this year is ground ambulance protections and mental health parity. So for ground ambulances, they were excluded from surprise billing protections nationally and on a state level. And we were waiting for the Federal Advisory Council to make rules for why ground ambulances were allowed to surprise you with a bill that you were unexpecting. And it's because of the nature of ground ambulances, and emergency medical is actually not under Health and Human Services or the Centers for Medicare and Medicaid. It's under the National Transportation and State Highway Authority, because
kidding.
the emergence of that type of medicine was actually meant to be transport only and not provision of medicine.
Mm.
And so it still exists under a transportation authority, not under healthcare. And so it was harder to control for those rules. And so we're working on that on a state and on a federal level. And then mental health parity is for the same type of coverage, protections, and expectation of care that you get for physical care. Can we please do that for behavioral health as well? And so we're working on legislation for that as well.
Cool.
Next slide, please. Thank you. So why is this work particularly hard now? And why did my colleague Adam reach out to you all to see if we could chat? There are two major things happening. One is Colorado is facing a massive budget shortfall. In around June or July of last year, we were hearing numbers like 800, 900 million. By the fall, it was at 1 billion. By January, it was 1.1 billion. And the most recent estimate is $1.2 billion shortfall. 32% of Colorado's budget is spent on healthcare. It's the highest spend proportionally. The next is education, public education, and then higher education, other, and then other services. 32% is the highest that Colorado has ever spent on healthcare. And so this is a massive shortfall, and a lot of it is going to hit our healthcare services, coverage, and programs. The reason why we're short is because we can't keep up with inflation, caseload, controlled maintenance, and a lot of that is also because of our unique status as a state that has the taxpayer bill of rights. It honestly, at this point, with Colorado's growth and its progressive policies, is becoming a really limiting factor in our state. Estimates from the Colorado Fiscal Institute showed that without Tabor, we would have had $500 million more for priorities. We still would have been in a deficit, but that billion, once we cross that $1 billion mark, it's really kind of unrecoverable. And to give a bit of perspective, last year we gave $1.6 billion in those tax rebates last year alone. So if we think about why the Tabor cap is limiting, we just don't have the ability to spend on what we need to match Colorado's growth. Colorado has grown exponentially in its people, in its programs, in its median income, in its need, in its older population. Young people are moving here, older people are retiring here, industry is coming here, and we just can't keep up with it. So we're also working on a coalition to do some investigating into what we can do about Tabor, just so that everyone's aware. It has been a question that's been on any one of our minds for so long now. And with this budget constraint in particular, it's feeling like an imminent need at this point. So letting go of just our general fund. So our general fund spend is, our budget is $15.6 billion. To give some perspective again, our federal funds that we receive amount to $12.5 billion. 72% of that $12.5 billion, or $9 billion, goes towards healthcare policy and financing, our HCPF department. And that is where all of the money gets spent out for Medicaid, for coverage programs, for all that caseload maintenance. So that's $9 billion of federal funds that add to our state pool of money to pay for healthcare. Next slide, please. Wow. So we're a little frantic right now because with proposed federal budget cuts, that people keep saying are 880 billion, but honestly, 880 billion is the floor of the cut. It could go as high as $2.6 trillion. We're a little frantic. These cuts aren't meant to revolutionize, modernize, or make more efficient Medicaid. They're meant to pay for tax cuts for the ultra wealthy and corporations. When I'm in less formal situations, I love to replace the word tax cuts and economy with rich people's yacht money, just so you understand exactly what type of advocacy organization we are. And these cuts they're not making anything better. They aren't intended to make anything better. They're intended to just reduce money that goes towards people who need it most. It was ironic, just a couple of days ago, we did a webinar with the Colorado Fiscal Institute on the need for Tabor reform and what these budget cuts mean. And as we were doing the webinar is when the final vote count came through for the House bill, for the House version of the budget bill with the $880 billion cut. So in real time, we got the vote that it had passed. Why we are frantic is now a ball is rolling. The Senate passed their version of the bill. The House passed their version of the bill. They're pretty different. But what happens now is that they are going to conference or negotiate to blend those together to find some sort of compromise or additive effect or reductive effect from those two bills to create a budget resolution. Once that budget resolution happens, spending bills start getting passed by the appropriations committees. So this is where each committee then looks and says, how much money does this need and that need? And so there's bills that then say what we're going to spend, what they're going to spend money on. And then it's reconciled with the budget resolution. And the fiscal year begins on October 1st, 2025. We need to get to people before a resolution is made. Congress is currently in recess. They're back. We anticipate that it'll probably be about a month, if all goes typically, about a budget resolution. And so some of the work that we're doing on a state and a federal level is telling our state legislators to talk to their federal counterparts and saying, you have to stop this. Like you do not understand what's going to happen in Colorado. Next slide, please. Who are those decision makers? Since you are the League of Women Voters, I assume that we're all at least aware of who our own representation is. But I wanted to highlight that I bolded 2 of these members of Congress for a reason that you'll see in a couple of slides. This is the split between Democrats and Republicans and the districts they represent. Next slide. Why these matter to Colorado? In Colorado alone, we have 1.2 million Coloradans on Medicaid or the Child Health Plan. Through the Affordable Care Act, we got Connect for Health Colorado in our marketplace here, and there's 282,000 Coloradans using that marketplace for coverage. 80% of those enrollees receive financial assistance, the federal funds, in the form of tax credits or subsidies or sliding scales. We've also seen record increases in enrollment through the marketplace in recent years. And we're worried about the expiration of those enhanced premium tax credits. If those enhanced premium tax credits, which were created in the wake of COVID, but if those enhanced premium tax credits expire, which they are set to expire at the end of this year, people who rely on them will see 50 to 70% increase in their out-of-pocket premium costs. And that would make it unaffordable for them, and they would likely not have coverage anymore. And that 50% is an average for urban areas. The 70% is a number more closely accurate for rural areas. We also in Colorado here have the Health Insurance Affordability Enterprise, the HIE as we call it. And this was an enterprise created. Again, enterprises are created in Colorado because of Tabor. So if we don't call something a tax and we call it an enterprise, we can use funds to do other programmatic work that is important to us. So the Health Insurance Affordability Enterprise, which is tied to our reinsurance program and other laws that have passed progressively, helps us cover undocumented folks or people who are otherwise excluded from federal subsidies to help them get coverage as well. One thing we know is that if people have coverage, they have access to care, and it also lowers the cost of the healthcare system overall. So that is currently covering about 14,000 Coloradans. And then not to ignore the small and large employer plans, that is something, again, from the Affordable Care Act. They are regulated in specific ways, and CCHI is a small employer. As I mentioned, we have 13 employees, so we participate in the small group market there for our employees, and there's 600,000 Coloradans on those plans. So if there are cuts, all of these folks with this type of coverage would all be affected. Next slide, please. Medicaid in particular. So Medicaid, as most of you may know, but just always want to level set at the top, it's a partnership program between the federal and state government. It is typically a 50-50 split for state and federal funds, but because Colorado and many states are Medicaid expanded, the incentive through the Affordable Care Act to expand Medicaid beyond the thresholds and beyond the populations that are required the incentive is a 90-10 split. So 10 with the expanded population, the state covers 10% and the federal government covers the 90% of that cost. So expansion programs cover different poverty thresholds. We have Cover All Coloradans. We have continuous eligibility for kids 0 to 3. So we have all these other ways we've expanded Medicaid beyond its bare minimum requirements. And so we get 90% of that expansion covered by federal funds, and we cover the rest with our 10%. There's a lot of misunderstandings about Medicaid. Medicaid is actually a super efficient system. The people who are on Medicaid, it might be a slow administrative system, but in terms of healthcare received and the costs, people on Medicaid typically don't have copays, coinsurance, other out-of-pocket costs. They receive the care that they need. And it's actually a lot more cost effective than a lot of other health coverage programs. It's also should be noted that Colorado has an interesting split with its rural and urban people here. There's more than 30%, I couldn't remember the exact number, more than 30% of the population in rural areas are covered through Medicaid. It's also super important to the sustainability of our hospitals, safety net clinics, and rural providers because they see Medicaid patients and they receive their Medicaid reimbursement for that. So those DSH payments, the disproportionate share hospital payments, they receive reimbursement for that coverage, and it has it is vital to their operating margins. And without that Medicaid reimbursement, they will fail. The Fiscal Institute, I believe, did this math. I forget who did this math, but I was sent this statistic at some point. For every $1 million lost from the federal government, Colorado loses $2.2 million in economic activity, 13,000 jobs, and $825,000 in added household earnings. So this is not just about the 880 billion or the 9 billion that we could lose. There's a multiplier effect to that. Next slide, please. So again, here's this decision maker table that I had. And the reason why I highlighted Heard and Evans is because their districts have the highest proportion of Medicaid enrollment, and they voted for the budget cut. I mean, 30%, nearly 30% and 25% of their constituents rely on Medicaid, and they're proposing a cut. It felt like such an egregious slap in the face to constituents that I would like to blast this everywhere. So they are our advocacy targets. All these other folks obviously also have a high proportion of Medicaid enrollees, but the highest two voted most vocally for the cuts. And so I just would like to have people see that.
Yeah, I'll take care. Heard as my representative, so I will be sending him some messages. Yeah.
Please do.
Oh,
Please
absolutely.
do. Next slide, please. So as I said, and as I tried to highlight, any cuts at the federal level is going to be devastating to us here in Colorado. And because of Tabor, we have no financial flexibility to respond. And then on top of that, we have a budget deficit. So even if we didn't have Tabor, we would have the budget deficit, and it makes it all the more challenging. And I personally am worried about the kind of domino effect that we're going to experience here. Colorado would also be disproportionately harmed compared to a lot of other states because we are one of the more progressive leaning and high Medicaid expansion population states. We were a part of a cohort of states that sent urgent, frantic letters and tried lawsuits to kind of Congress early on when these conversations started happening in January. There are 1.1 million Coloradans on Medicaid, and we would lose $1 billion a year, and 400,000 Coloradans would lose coverage. That's not insignificant. Even if it was 5 people, I would still be screaming about it, but that's a big number. We're already experiencing a lot of, like I mentioned, these hospital mega systems gobbling up independent practices, rural clinics, and providers. And a lot of that is because of the financial tenuousness of their margins. And with cuts like this, we'll see not even mergers and acquisitions, but full-on closures because it won't be sustainable to run them anymore. That would mean that people in rural areas might have to travel up to 100 miles just for a basic appointment or more, and might not even get to see a provider. And so that is one of the things that we're super worried about. And that domino effect of people losing coverage, losing access to care, getting sicker, losing jobs, losing their homes, losing all of the things that make life barely survivable, is kind of what we're extremely worried about. Next slide, please.
There we go.
Nope.
Oh, it's not going. Why is it not going?
We have two of the same slides by accident. Did I duplicate that?
It's not moving. Uh-oh.
Well, my next slide is what are we doing?
Okay, shoot, all of a sudden now I can't progress it any further. Do you want to take over with your computer?
So let me see if I can quickly, I mean, I just have one, it's just one slide. That's a what are we doing? And then I was going to open it up for a discussion.
Oh,
But
okay. Okay.
the what are we doing is joining our federal advocacy coalition. So back in 2016, 2017, CCHI started a federal action campaign called Protect Our Care Colorado for the first round of Affordable Care Act repeal threats. We still have the old poster boards in our office and the old kind of materials from that first version of that threat. And we dusted that off and refreshed it for this new landscape we're in right now. So Protect Our Care Colorado is a federal action campaign. We have a website, talking points. We have a button if you would like to share your story or send it for others to share their story about why healthcare, Medicaid, and the Affordable Care Act is important to them. There's social media content on there. There's tools to connect with Congress. There's information about your particular congressional representation. There's also information about contacting your state legislators. And then that's where Adam uses, my colleague, Adam Fox is the deputy director at CCHI. And that's the same kind of framing that he uses for any direct action. So as an example, a couple of days ago, before we knew that the vote was for sure happening on Tuesday night, he sent out a sign-on form. We want to send this out to a representation. Here's a phone number to call, flood their phone lines. The vote is happening maybe today at 5 o'clock. Here's what you should say. Here's what we care about. Here's a template. Here's a social media post. And so all of those action alerts happen there. We also include information like, the Center for Budget Priorities hosted a national webinar talking about what their plan was for some federal action. We have national partners who host calls saying who got some wiggle room with one of their moderate Republicans. And so there's a lot of action happening on a federal level, and relying on state and local partners to push that louder and louder is where we're doing that work. So
can you share that where that site is again?
Yes, I can. And I'll do that in the chat. It is on the slides, but I can share that in the chat right now.
Okay.
So, I also want to recognize that I just presented a pretty grim story about a lot of what's going on right now. And it is grim, honestly. And regardless of how you feel about this individual politically, personally, or her acting skills or her workout skills, Jane Fonda recently said, optimism is kind of this blind faith without action that you think something good is going to happen, but hope is a muscle that you have to exercise.
Oh, I like that.
Hope is a muscle that is fed and nourished through seeing action happen, seeing positive things happen. And I really needed to hear that. I personally love Jane Fonda. I think she's a bit of a wild card. But she spoke recently at some awards show that she was getting some award.
Yeah, she got some lifetime award. Yeah.
And she was talking about how this is our documentary moment. If you've ever watched a documentary and wondered who you would be in those moments of major social change and social movements, you should ask yourself that question today, because it's happening now. And so with the grim picture, there's a lot of people who are trying a lot of things and who are doing a lot of work. And I catch myself hopeful in different moments. And there's also a poem I share with my colleagues and my staff whenever we're feeling a little overwhelmed by the work, that's called Stubborn Ounces. And it basically, the premise of the poem is, regardless of whether or not I'm going to win, I don't know if I'm going to win, but you're going to feel the stubborn ounces of my weight. You're going to feel it awesome, whether or not I manage to change anything. And that kind of keeps us going.
Yeah. Yeah, the League of Women Voters has similar mentality for sure.
I imagine.
Yeah. Okay, there it is. Protect Our Care Co. Okay. Let me write that down. we will certainly share slides afterwards. Probably tomorrow I can get them to everyone, but right now, I think we should have some questions and conversation. Anybody, go ahead and raise your hand or just unmute yourself. And since I think I can see everyone on one screen, so you can just go ahead and unmute yourself and give us your thoughts and questions. It's an amazing time right now. And I know I'm out here in Gunnison County, and I heard that our local county hospital operates on like a 1 or 2% margin. And if any amount of Medicaid funding is cut, I don't know how it'll stay open. And I'm sure that's the case for not just small rural hospitals, but even metro hospitals that care for a lot of folks that are on Medicaid or similar programs. We have a question here in the chat about what do we say to our representatives? Is that, Joyce, is that what you were asking?
Yes, that's what I'm asking. What are the talking points? Because what we're going to get is either a recording or a very pleasant person who answers the phone. And of course, we're very polite and say, hey, this is who I am, and so forth and so on. And this is my ask. And thank you very much for taking my call. But what are some of the key phrases that might sway some of these folks?
Sure.
If there are any.
I mean, the biggest threat to any politician is not getting reelected, right? And so tracking which of our congressional or state elected officials are looking for reelection and who have constituents who are on that. So the main tagline is don't kill Medicaid, right? Millions and millions and millions of 80 million Americans rely on Medicaid in this country, 80 million. And that's not including all of the different expansion programs. If you cut Medicaid, your economy in your district will also tank, because without that Medicaid coverage, people are going to lose healthcare. These are going to be uninsured folks going into your emergency departments that are not going to get reimbursed for the Medicaid day. And providers will quit, hospitals will close. The focal point for a lot of these districts and a lot of these counties are going to die, and you will not have an economy in your district.
That's a good one. That's a really good one.
People will vote you out.
And obviously, if that big of a percentage of anyone's constituents rely on support through Medicaid or other similar programs, they're going to vote against you next time. Yeah. Jim, do you have I see you unmuted yourself.
I did. Thanks for the information about Jeff Hurd. I'm also in his district. Do you have any idea how many hospitals are in Congressional District 3?
We're actually getting this information right now, so I can share that information. I currently sit, so I also am a board member of the Colorado Healthcare Affordability Sustainability Enterprise, which is the hospital provider fee. And that board looks at the financial viability of every hospital in the state. So I get information on what services they offer, how they're doing on quality reports. And HCPF, our Healthcare Policy and Financing Department, is actually right now pulling district level data that we're requesting on all of the hospital finances and the numbers and closures and ownership. So I'd be happy to share that.
That would be awesome. Yeah.
Great, thanks.
Okay.
And if you send it to me, then I can get it to everybody in this group. Marcia, do you have a thought? Oh, you're unmuted, but I don't hear you. Try again. No, you want to put it in the chat? And then Suzanne wrote in the chat, when would proposed cuts go into effect? When will Congress decide if Medicare will be cut? Yeah, yeah. You said they're on recess right now?
They're currently on recess for another 2 days, I think.
Oh, okay, okay.
The timeline is now that the Senate passed their version, which is a much narrower version, and the House
Mhm.
passed theirs, they are going to conference, which means they're going to look
Mhm.
how they blend it together.
Mhm.
This could take weeks, this could take months, depending
Mhm.
on if we manage to flip moderate Republicans, if we manage
Mhm.
to put enough pressure saying this is untenable, we will shut the government, right? We will all stop
Mhm.
working. We will all stop doing whatever. Like there's a bunch of different economic blackouts happening. So depending on how
Yeah,
successful some of those direct actions are, it could take months, but we anticipate that they're probably going to come to a resolution sometime in the next month or two. When they do that, that's when those appropriations committees and spending bills start getting drafted. They probably honestly have already drafted them in preparation of this, but that's when they'll be adjusted to match the proposed resolution that's conferenced. And the fiscal year starts in October 1st. So all the spending that has already been appropriated will be spent, as we learned a couple of weeks ago when spending freeze was tried. When they tried the spending freeze, they stopped the spending freeze. And so, you know, money's already been appropriated. It's already functionally been spent. So the money that is currently counted is the money we still have until September 30th.
Mhm. Mhm.
But the new fiscal year, the proposed cuts, and the way this works is whether it's 880 billion or 2.1 trillion, it's actually cuts over the span of 10 years, but it's not evenly divided over 10 years. And depending on how closely the administration follows predictable procedure, is what I'll say diplomatically. It could happen all immediately. It could happen progressive over time. It could be more kind of layoffs and shutting down programs and pulling benefits. We just don't know, honestly. But the fiscal year starts October 1st, but a decision will be made months before that, unless there is a full government shutdown.
And the Senate, even, they just have to pass it by a simple majority, correct? Not 60%.
Mhm.
Okay. And then Marcia put her question in the chat. She says she needs a fact checker. If she's heard that blue states send more money to the feds than come back to us. Is this true? I've heard this too, Marcia. Or read this, I guess.
So I will verify my response, but I will say that that is a bit of a misleading statement. What that is probably responding to is looking through a peephole of a picture and not the whole picture. So an example of where somebody might assume that that is true or might use kind of information to, might use information to suggest that that's true is, again, an example is the hospital provider fee. So all states have, there's a federally required hospital provider fee where you charge hospitals essentially a tax, and it can be no more than 6% of their net patient revenues. And that suggests how many people they're serving, right? If it's a net patient revenue, you can assume that that's related to how many people they're serving. And then we fiddle with a formula, and then it gets sent to the federal government, and they send back money. So in Colorado, for example, we have it as an enterprise because of our Tabor laws, but we charge the hospitals up to 6% of their net patient revenues. We're charging about 5.7%. And they are sending hundreds of millions of dollars into one pool. The federal government says, okay, based on your programs, demonstrations, expansion, your disproportionate share of Medicaid folks, here's all the money we think we should give back to you based on estimated costs of how much you're really covering in terms of care. So for every something like for $250 million sent out of Colorado, we get back $500 million. And so we are sending more money, but we are getting it back in matched funding that then gets dispersed through equations that say this critical access hospital spent more on Medicaid patients, and this urban center had more commercial. And so it's split up by commercial market, public insurance. And so folks were just looking at what a big urban center was getting back. There are urban centers that are paying more in a fee than they're getting back in theory, but the money gets spread across need. So that would be an example of where I think a talking point like that would come from, but it's not accurate.
Is this the Chase program?
It is the SHAPE program.
Okay, just wanted to make sure.
Thanks, Jim. Also, Sue put in the chat that a good site for talking points and easy messages for taking action, and you guys can see it. It's at the National Council Quorum .us /campaign, etc. So that might be a good thing for everyone to jot down as a resource.
Yeah, and I think we have on our Protect Our Care website, and I'll check with Adam about this, but we also work with the National Immigration Law Center. We work with the Georgetown Center for Children and Families, and they also have a lot of messaging that's going out. We're trying to encourage our national partners and friends where possible to have a consistent core message, and then the details different depending on the content area. So we're trying to coordinate with them on that, because the thing that I think we need to learn how to do better is that tagline. We need a punchline, a tagline, because, you know, nerds like me will get into the specifics about a fee versus an enterprise, and no elected official cares about that.
A good point. Yes. Anybody have questions or comments on this topic? It just, it blows my mind that we, like-minded people, see this as a very critical issue that will change our way of life if it all goes through. How do we get that messaging across that media divide? You know, like my news is so different from the news my neighbor gets, you know, who's conservative. And I think that's part of the problem. Unfortunately, if the federal government slashes the budget, everyone's going to feel it. But it would be really helpful to prevent that catastrophe before it happens. But maybe that's what it's going to take. I don't know.
Well, and I would love all of your expertise on how to do that, because we have a media presence. So CCHI is often, the reporters in the state know to call us when there's a consumer protection issue. They know to call us about patient stories, right? And we have we sometimes get on, you know, Kaiser Family Foundation news, and sometimes, you know, a blip on a national news story. But I think what we need from cohorts, coalitions, and groups of people and organizations like League of Women Voters Colorado and your healthcare task force is like, we need a groundswell of information that matches the volume on the other side, right? Because it's not just that we believe we are correct and that we can see things that are happening that are going to affect everybody, no matter which side you vote for. If they're not hearing it, it doesn't matter, to your point, right? So like, and we're trying to prevent also the inevitable, which is going to happen. It's already happening. We've seen countless stories of folks who voted for the current administration who did not believe that the changes would negatively impact them, and they are.
Right.
And we are seeing veterans getting fired and veteran services getting cut and SNAP benefits. And they said, wait, that's not DEI, or that's not what I was talking about. That's not what I was voting for. And they're experiencing that harm that they inadvertently inflicted upon themselves through the manipulation of a grand campaign. And it's really hard to watch, but I think capturing those folks and saying, we would love for you to tell your story about how you believe how you voted was wrong, right?
Yeah.
Now call and say, I voted for you and you promised me you would take care of me, and you've done the opposite. You've harmed me now. I think those stories are actually going to be way more compelling than the chorus singing to itself.
Right. Exactly. Jim, go ahead.
I just wanted to share a story about Jeff Hurd. Last Monday, the Montezuma County League of Women Voters had scheduled an appointment for his aide, Naomi Dobbs, who was going to come to the town of Dolores with a population of about 2,000 in the library. And the library meeting room could accommodate 50 people.
Mm.
400 people showed up with signs.
Wow.
The aide showed up. The sheriff was there. He said, I will give you a safe conduct in.
Mm.
And she declined and went away.
Oh, she didn't even stay?
No.
Oh my gosh. So Jim, that story needs to be told. Like, I don't know, you need to give it to the office in the League of Women Voters. Even if you email that information to me, I can pass it on. We can get it somehow to our membership on our website. You know, we can use that. That's really important, I
Well,
think.
I think Karen, she will take care of that.
That's true. Yeah,
Yeah.
that's
I'm
true.
going to see
Yeah.
her tomorrow, so I'll
Okay.
tell her what you
Yeah,
said.
make sure. Right.
Okay.
Fantastic.
I mean,
Wow.
that is Heard ignoring 400 constituents we're expecting to be heard, right? And that is, again, that is the type of media story that if the League of Women Voters can elevate that story, and we can do
Right.
that all the counties every time somebody's
Mhm.
trying to take a meeting,
Mhm.
you know, I am an avid reader of history, and there is a lot of history repeating itself in this kind of tipping point. And regardless of which side you vote on, what your political beliefs are, what your spiritual beliefs are, it doesn't really matter. Right now, it's a class war against people. Like that's what I perceive this. And I think the threat of accountability is the thing that they fear the most.
Right. There's a couple of comments in the chat here before we wind up. Has CCHI shared this information with Colorado congressional officials?
We have. We were actually in Washington, D.C. on the day after Inauguration Day, at a conference with one of our national partners, and a few of the CCHI staff had set up meetings with our congressional delegation there. So we went into their offices and shared with them, anticipating exactly what has just happened this week, and sharing information, county level information, district level information, and saying, this is what's going to happen. And they all said, thank you for the information, be on your way now, right? And so then we've also contacted their local offices here. We've sent information. Adam is in pretty regular contact with them. And then we're also working with other partners like the Center for Health Progress, the Immigrant Rights Coalition, other folks that work on advocacy, to make sure that it's not just one person, one organization saying it. And again, like I said, through the Protect Our Care website and through the email list, when organizations sign on, Adam also uses an email listserv to send, here's a sign-on letter. If you sign it by Wednesday, we're sending this to 6 district offices. We're sending this to this congressional committee, or we're sending this to, the Joint Budget Committee. And so when there's an opportunity to send a unified message, we do that, and then also give folks templates if they would like to do it on their own, as an individual or on behalf of your organization or your family or whatever, your church, whatever it is. So we make sure that folks have the ability to also send their own tailored message, but we have sent all this information out.
Okay, great. Yeah, the league has that kind of communication pretty well structured as well. And then another comment from Suzanne says, have you heard that Republican Congress people have been told to not hold town hall meetings now that they've blown up in their faces?
I have not heard that directly out of any individual's mouth or email or text, but I'm not surprised. I would not be surprised if they were being told to kind of cool it with public accountability.
Some of those videos have gone viral.
Yes. The one that was the most upsetting that I wish I hadn't seen the footage of was the Coeur d'Alene town hall. honestly wish I had read the headline and said, oh, that sounds terrible.
Mm,
Let me not look.
mhm,
And I think there's two sides of that safety issue, right? For individuals who are at those spaces, who are trying to advocate for the things that we care about, and elected officials are obviously concerned about their safety for a variety of reasons. So again, I will never tell anybody which way they should advocate. And we talk about that safety issue at CCHI. Also, half of our staff are quite young. They're under 30. So I'm a little bit concerned sometimes for when there are
Sure.
protests about everyone's kind of individual autonomous safety. But we do a lot of work that puts us in at least hypothetical threats and risks.
That might shift in our favor once people are, conservatives are affected by these budget cuts.
And again, I think based on the couple of comments and questions and stories, I think again, the shiftable folks, ones who thought they knew what they were voting for and are now experiencing the consequence of that. Right? They were lied to. And also I think there's a lot, and again, I'm sure you all have the same shared experience and kind of expertise, but there's a lot to be said for where we show compassion and grace and where there's a bit of shame. And I think people should not experience shame. Our elected officials and our institutions and the corporations should, but battering somebody who's already now experiencing the consequence of their vote based on a system that was to lie to them is never going to be the way that I would go about it.
Sure.
I have colleagues who disagree with that, but not at CCHI. At CCHI, we move first compassion and then see what happens.
Same, yeah.
But they're not to blame. They're elected officials, and the people who control all the money are. So.
Right.
Can I read Sue? Can you hear me?
Yes, now we can, Marcia. Hooray.
You can see and hear me.
Yes, ma'am.
I'm going to read Sue's note, which said, thanks for your good work in providing a clear focus for advocacy. I appreciate that. She's our lead person in our local healthcare up in Larimer County.
Wonderful. Thank you,
So
Marcia.
thank you. Thank you very much.
Thank you.
Yeah, and we'll have to, brainstorm a little bit about how our two organizations can work more in concert so that the message gets amplified.
I would love that. Another thing that I would love to request from you all, I've heard through a couple of the folks who've spoken up that you're in rural and dispersed counties. We're not all Denver centric folks.
No.
Right? And our consumer assistance program, so our consumer assistance program director actually lives in Durango. One of the coordinators lives in Grand Junction. Our fellow lives in Colorado Springs. And we're trying to make sure that people in more dispersed counties know about that assistance program, that free assistance program. And whatever happens, a cut is coming, right? Like we know that there is going to be a cut. We just don't know the scale of it. And when that happens, people are going to lose coverage, lose their employment, and their medical bills are going to become something that they're more scared of and need more assistance with. So we're actually anticipating devastatingly an uptick in folks who need that assistance. And we need better depth and reach in rural places.
Okay.
We've started moving, some staff have moved and we've set up kind of, we go to libraries and do know your rights presentations. We go to the local public health offices, but wherever we can have stronger connections in those spaces, that's one of our goals for a consumer assistance program. And I would love to make sure that we're connecting with League of Women Voters folks who are there, who would like to share this information.
Fantastic. Yeah, we can do that, certainly. Great. Okay. Anybody have any other final comments or questions? This is regardless of our, choppy beginning tonight, of which I do apologize for. This has been really informative, rather gloomy and dark, but we knew we would be here. So it's up to people like us to carry the message and do it in a concerted effort. And the more coalition building we can do, the stronger we all become.
Absolutely.
So Thank you, Manat, very much.
I appreciate all the work that you all do too, and inviting us here to kind of share what we're working on. I appreciate it so much. I shared my contact information in the chat.
Mhm. Mhm.
The best way to reach me always is a text message or a phone call. I am a classic millennial in that way, but my email is great for any formal
Yep.
communication. We will follow up, and I'm really excited to see what we can leverage together.
Yeah, that makes perfect sense. And I will, tomorrow, I'll send the slides to everyone and also those that signed up but didn't jump on. I'll send those to them as well with contact information and some of the thoughts that we've had tonight.
Perfect. Thank
Yeah,
you. so
thanks.
much for your
Thank you
time.
so much. Now go have some good dinner and we got to keep our strength up.
Thank
Thank you, everyone. All right, take care.